Hello, good afternoon. My name is Vivian Ramos, doing the second video health assessment. And this is my Seneca ID. Roll the camera 360 degrees. Hello, good afternoon. I'm Vivian. I'm going to be your nurse for today. Before we start, can you please look at your armband? Can you tell me your complete name?
I'm Mary Brown.
Your date of birth?
September 29, 1961.
Do you know where you are?
Yes, I'm in the clinic right now.
Oh, what brought you here in our clinic?
I'm not really feeling well. I have stomach pain and chest pain.
I'm so sorry about that. I'm going to perform a thorough assessment for you, focusing on your heart and gastrointestinal system today. Would that be okay with you?
Sure.
As it involves some touching, but I'll ensure your privacy. So I've already checked your vital signs earlier, and I'm going to report it to the doctor later. I'm going to ask you some questions. Do you have any shortness of breath?
No.
Do you have any chest pain or pressure?
Yes, I have.
And do you have any history of irregular heartbeat?
No, but I think it might be getting faster right now.
Do you have any cardiac or GI history?
Yes, I take a pill because of my cholesterol is high and also with my blood pressure.
Are you dizzy or do you have any vertigo?
No, but I just feel tired.
And have you noticed any swelling or edema?
No.
And any abdominal pains right now?
Yes, I do.
Any nausea or vomiting?
No.
And I think you said earlier you
Oh yeah, I
vomited
felt
once, right?
nauseated and I vomited
Yeah.
once.
And any difficulty swallowing your food?
No, I'm okay.
And any food intolerance?
Yes, with spicy foods.
How about your appetite?
Appetite is good.
Do you drink alcohol?
Yeah, I do.
How about caffeine?
Every day.
And how's your bowel habits?
It's normal.
Any medications?
I drink a bunch of medications. I take a bunch of medications.
Any allergies?
No allergies.
Any issues you want to report to me?
Regarding with my pain, do you think I have a heart attack?
So with that, I'm going to do further investigation and make sure that this is reported to the doctor. So I did your pain assessment earlier, and this has been done using the OPQRSTU. But to further assess, does the pain radiate to other part of the body?
No.
And for the chest pain, if you rate it 0, no pain, 10, excruciating pain, what is it?
5/10.
How about abdominal pain?
It's 8/10.
Okay, thank you for letting me know. So I'm going to be focusing assessment on your heart and abdomen, like I said, including inspection, palpation, and percussion and auscultation. So for the heart, there's no jugular distension noted, no edema, color is pale, the precordium is symmetrical, no heaves, and no pulsations. So I'm going to palpate your carotid artery. Okay, now your brachial pulse, your radial pulse, femoral pulse, and now your dorsalis pedis. And then your yes, the capillary flow is less than 3 seconds. That's good. Now I'm gonna listen to your heart sounds using my stethoscope. Okay, so I'm gonna start with aortic valve. S2 is louder than S1. Pulmonic valve. S2 is louder than S1. Erb's point. S1 and S2 are equal. Tricuspid. S1 is louder than S2. The mitral valve. S1 is louder than S2. So now I'm also checking your apical pulse for a full 1 minute, provides accurate info of the heart's rhythm, strength, and quality. So there's no hips, no thrills, no vibratory sensations. Apical pulse is 105 breaths per minute. And now I'm going to use the bell to detect S3 and S4. S1 and S2 are all noted. Okay, so no murmurs detected, so no more swishing sound, and it is like represents there's some blood issues in the chambers of the heart. So for the abdomen inspection, the contour abdomen is flat and symmetrical. Skin, no lesions, so no scars, no striations, and no hernias noted. Umbilicus midline is no discharges and no discoloration. Aortic pulsations is not observed. So now I'm gonna auscultate your abdomen before percussing. So I'm gonna listen to the right upper quadrant, right lower quadrant, which is your appendix, right upper quadrant, liver and gallbladder, left upper quadrant, which is your stomach and spleen, left lower quadrant, which is your descending colon, or normal active vowel sounds present in 4 quadrants. So vesicular sounds using the bell. Okay, so aortic, both renal, both iliac, both femoral, no breath sounds in 7 areas. So now I'm gonna do percussion. In all 4 quadrants, no dullness, all tympanic sounds. For palpation, Okay, I'm gonna do soft palpation. Any pain?
Yeah, it's painful there.
Okay, so there's guarding, but no rigidity and masses. Now, deep palpations. Okay, so I'm gonna call your doctor and inform about the situation right now. Hello, good afternoon, doctor. I'm reporting about Mrs. Brown. She's a 60-year-old female presented to the clinic right now complaining of chest and stomach pain, along with nausea and vomiting. Vital signs indicate tachycardic 105 breaths per minute, elevated blood pressure, afebrile. She is a history of type 2 diabetes, hyperlipidemia, hypertension. She takes her medications for high cholesterol and blood pressure. No history of irregular heartbeat reported. Upon assessment, Ms. Brown appeared pale. No abnormal pulsations or heaves observed epicardium. Her abdomen was flat and symmetrical, with no abnormal skin findings or pulsations noted. Precautions to tympanic sounds in all 4 quadrants. Palpation of pulse sites and abdominal organs showed no abnormalities or tenderness. Auscultation of the heart revealed no murmurs and no abnormal sounds, while active bowel sounds were all heard in all quadrants. I recommend that Mrs. Brown do further assessment with a healthcare provider. Continuous monitoring of the vital signs is recommended because of her hypertension. Comfort measures and pain relief for the pain is necessary. Expected physician's orders may include electrocardiogram and lab tests to evaluate cardiac and organ functions. Image studies is also requested to the underlying cause of the symptoms. Patient may be experiencing angina pectoris or myocardial infarction, or for the gastrointestinal issue, gastritis or GERD. Okay, I've just talked to the doctor. Any issues to report?
And so far, thank
Okay,
you.
we'll update you. Okay, thank you.